Hello, my name is Dr. Sai Kottapalli, one of the vascular surgeons here at Vegas Vascular Specialists, and today we're going to talk about peripheral arterial disease. You're probably familiar with the term angina or heart attack, which are related to blockages of blood flow to the heart. The same sort of blockages can happen elsewhere in your body, depriving the limbs, which are the peripheral part of your bodies, from getting enough nutrients or oxygen. When this is left untreated, the disease can progress and can eventually lead to amputation. In the early stages of peripheral arterial disease, the lack of blood flow during high-demand activities such as walking or running can cause a sensation of pain, cramping, or tiredness in your legs. This primarily occurs in your calf area, but can also happen within the thighs or your buttocks. And this pain usually resolves with rest, and that's why we call it claudication. With progression of disease and blockages in multiple different arteries within the lower extremities, patients can then progress from having pain even at rest, as well as having pain while sleeping. And this is what we call rest pain. When left untreated, further progression of peripheral arterial disease can lead to non-healing wounds on the extremities or infection of the skin. If blood circulation is not restored to the affected extremity in a timely fashion, a patient's extremity might not be salvageable and might need amputation of digits or higher level of amputations. If peripheral arterial disease is suspected as the cause of your symptoms, your medical doctor or your vascular surgeon may order an ultrasound of the arteries to check for the extent of blockages. Depending on the physical exam findings, your vascular surgeon may then order a CAT scan to evaluate the blockages and to plan for the best approach to treat your peripheral vascular disease. Majority of the patients in the early phases of peripheral arterial disease do not need any procedure or surgery. Lifestyle changes such as smoking cessation, control of diabetes, blood pressure management, and regular walking or an exercise program might be sufficient to control your symptoms of peripheral arterial disease. Medications to help with walking distance as well as to decrease the plaque buildup in your arteries will also be prescribed by your medical doctor. The natural history of peripheral arterial disease is that the majority of the patients will only have pain while walking and do not usually progress to the point where they have pain at rest or have tissue loss, which is what we call critical limb ischemia. If a patient has lifestyle-limiting claudication or pain in the legs that is interfering with activities of daily living, such as being able to work or shop in a grocery store, your vascular surgeon might offer you a procedure called an angiogram, which is a same-day outpatient procedure. During the procedure, a needle stick, usually in the groin area, is used to evaluate your blood circulation in the leg, and if there's any blockages that are noted, they can be usually treated by removing the plaque or ballooning the plaque or stenting the artery from the inside. Some patients with plaque in areas of the leg that are not suitable for treatment with minimally invasive techniques, such as plaque usually in the groin area, is better treated by making a small incision over the artery and removing the plaque from the area, thus restoring the blood flow to your leg. And your vascular surgeon might at the same time opt to place a stent in another blocked artery during the same procedure. When the blockage in your leg is severe or you have failed multiple minimally invasive endovascular procedures, your vascular surgeon might determine that you have a better and a more durable result with what's called a bypass. Studies have shown that in patients with long and severe blockages in their arteries, a bypass is more suitable and a more durable result compared to minimally invasive procedures. So your vascular surgeon will weigh the risks, benefits, and alternatives in your case and present you with all the options in order to make an informed decision regarding the treatment plan. After your peripheral arterial disease is treated either with minimally invasive techniques or using open surgery or bypass, your vascular surgeon will monitor the patency of your treatment and will perform surveillance of your arteries on a regular basis in the clinic. Peripheral arterial disease is chronic and most often is progressive. Hence, it's really important that your vascular provider, whoever you choose, will continue to monitor you over the years. If you have any further questions regarding peripheral arterial disease or any other vascular problems that you have, please visit us at vegasvascular.com or call our office to make an appointment or let your medical doctor know to make an appointment with us, and we'll be happy to discuss your medical problems at that time.